A PSG may help in the diagnosis of this disorder. Like many disorders relating to sleep, treating primary hypersomnia disorder is not easy. If patients do not seek treatment, they may find that symptoms worsen. Treatment is aimed at lessening the impacts of the disorder and is usually medicinal. The potential medications offered are Ritalin, methylphenidate; Provigil, modafinil; Xyrem, sodium oxybate; Dexedrine, dextroamphetamine. Primary insomnia disorder. Patients suffering from primary insomnia disorder will be unable to fall asleep, or stay asleep, or may wake up too early. This prevents them from feeling rested, even when they have slept. Insomnia caused by medication, psychiatric disorders, or medical issues does not count as primary insomnia, but secondary insomnia. This disorder will have a negative effect on the patient's ability to function day to day, and may recur for a month or more. Causes. Primary insomnia disorder usually has a direct cause. This could include an environmental disturbance, such as a lot of noise or light. It might also result from jet lag, where a patient is used to a different time zone. It may also be a result of bad sleeping habits. Symptoms. There are a few symptoms of primary insomnia disorder, most unsurprisingly, related to poor sleep and tiredness. They include waking up too early, disrupted sleep, fatigue, difficulty concentrating, inability to fall asleep, not feeling refreshed after sleep, irritation. The patient is likely to experience some distress as a result of their difficulty with sleeping. Treatments. Treating may be as simple as addressing the environmental issues if they exist. It might also involve one or more of the following: medication, such as Benadryl, diphenhydramine, zolpidem, or temazepam. Behavioral therapy, aimed at addressing poor habits which could lead to disrupted sleep. Relaxation therapy, aimed at helping the patient cope well with stress, so that they are more likely to sleep well. Sleep paralysis. Sleep paralysis is when a person feels that they are unable to move or speak when they are just waking up, or just starting to fall asleep. This is not a sleep disorder, but understanding it is important when dealing with sleep disorders. Many people will experience sleep paralysis at some stage in their lives, but usually only once or twice. It is often a frightening experience, but is not usually harmful in itself. Causes. Sleep paralysis has several potential causes. It is usually a result of the brain being active while you are in sleep mode and can last for several minutes. This can happen for a number of reasons. Post-traumatic stress disorder, panic disorder, genetic history of sleep paralysis, disruptions to sleep patterns such as jet lag, insomnia, narcolepsy. Symptoms. As mentioned, a person who experiences sleep paralysis will feel that they are unable to move or talk when they're in the phase of waking up or going to sleep. People suffering from sleep paralysis may also feels as though someone else is in the room, feels as though there is a weight on their chest, sense of fear. Treatments. Sleep paralysis isn't necessarily easy to treat, but good habits can help to reduce it. These might include getting 6 to 8 hours of sleep each night, exercising regularly but not too close to bedtime, going to bed at the same time each evening, and getting up at the same time each morning. Avoiding big meals and caffeine, nicotine, and alcohol just before bed. Sleeping on your side or stomach, as sleeping on your back, can increase the chances of sleep paralysis occurring. Self-harm and suicide. Introduction. We are going to discuss self-harm and suicide. We are going to look at the potential causes and what signs should be looked for to prevent people from self-harming or committing suicide. We are going to look at some potential treatments and support services which are in place to help people who are at risk of self-harm or suicide. Topics to be covered. What is self-harm? The self-harm cycle. Why do people self-harm? Support services and treatments. Self-care. Suicide. Risk factors. Suicide, mental health and self-harm. Suicide prevention. What is self-harm? Self-harm is behavior which is destructive to a patient's self as a result of difficult or distressing emotions. Self-harm can be major actions or minor. It often appears as cutting or burning, but can also take the form of non-lethal overdosing on drugs. Any behavior which seeks to cause injury to a person's own being because they are struggling to deal with their emotions should be considered self-harm. The self-harm cycle. Self-harm often brings a temporary sense of relief to patients. It may help to relieve the pressure caused by strong emotions. However, this feeling will soon fade because it will not solve any of the issues causing the emotions. This can very quickly lead to a cycle in which the patient becomes dependent on self-harm to deal with their feelings. It is also likely to cause a sense of shame and guilt. Figure. Self-harm cycle. Emotional suffering. Emotional overload. Panic. Self-harm. Temporary relief. Shame or grief. Why do people self-harm? People's reasons for self-harming can vary enormously. Most of the time, it is prompted by people feeling excessive pressure and being unable to find a healthy outlet, such as talking to friends. Emotions build up and the patient expresses them by harming themselves. Some potential reasons for self-harming include school pressure, bullying, anxiety, depression, low self-esteem, major life changes, drug or alcohol abuse, problems at home, difficulties with friends. Support services and treatments. If you are looking for help, there are lots of services and treatments available. You might want to contact your GP, who will be able to organize counseling sessions, such as cognitive behavioral therapy and other talking therapies, can help you build coping strategies and problem-solving skills. They may also be able to recommend you for psychodynamic therapy, which can help you identify what the underlying problems are. UK charities, who will be able to put you in touch with other sufferers, and may be able to offer other support. Self-care. There are several steps you can take to look after yourself while dealing with self-harm. Stay safe. Make sure injuries are treated and no infection is allowed to spread. If injuries are serious, seek a trusted adult to help you deal with them and get medical attention. This is crucial if you feel you are going into shock, feeling faint, heart racing, fast breathing. Be kind to yourself. Try to be satisfied with your own work and feel good about your achievements, instead of looking for faults. Talk to someone. If you are able, start opening up to others about issues. It will help to start small, and then approach bigger worries slowly. Find people you trust in a crisis, and turn to them when you need help. Avoid drugs or alcohol. Alcohol is a depressant, and can make you feel worse, and both drugs and alcohol reduce your inhibitions, and can put you in dangerous situations. They are often turned to as a temporary fix, but they are best avoided. Find activities you enjoy. Hobbies such as reading, painting, walking, gardening will help boost your mood. This will improve your mental health and self-esteem. Make a safe box. Fill a box with things which help you feel happy and calm. You might add favorite books, films, a few puzzles, and perhaps lists of calming activities or good things about your life. Suicide. Suicide claims the lives of around 800,000 people across the globe every year. In 2018, there were over 6,000 deaths by suicide in the UK. Men accounted for over 3/4 of these deaths. Suicide and attempted suicide can have very major impacts on people, their families, and their communities. There are many underlying causes of suicide, and it can be difficult to understand and address all of them. In 2019, the theme for World Mental Health Day was mental health promotion and suicide prevention. Risk factors. Suicide is very complicated. Cultural, psychological, and social factors all play a role. Sometimes suicide may be the result of impulse, and other times it will be a thought-out process. The World Health Organization has classified the risk factors which can increase someone's vulnerability to suicide as follows. Individual. Financial loss. Previous suicide attempts. Drug and alcohol abuse. Mental health problems. Family history of suicide or attempted suicide. Self-harm. Chronic pain. Relationships. Lack of social support. Relationships breaking down. Conflict or loss. Societal. Inappropriate media reporting. Ease of committing suicide. Difficulty getting care or help. Stigmas attached to mental health problems. Community. Trauma or abuse. Discrimination. Disasters, conflicts, wars. Poverty. Suicide is usually a result of the different aspects combining and overwhelming the sufferer. Suicide, mental health and self-harm. How do suicide, mental health, and self-harm link up with each other? Obviously, there are connections. That does not mean everyone who has a mental health issue or who self-harms wants to die. However, many people with diagnosed mental health disorders are at greater risk of feeling suicidal. Individuals who self-harm are also at increased risk of suicide or attempted suicide. If help is not offered, self-harm could progress to suicide. Suicide prevention. Suicide prevention is complex and often requires approaches from several different areas. The National Suicide Prevention Strategy for England suggests making it harder to commit suicide, for example limiting painkiller purchases, providing better support to those who have lost a loved one to suicide, focusing on high-risk groups, such as young men, people who self-harm, criminals, encouraging sensitive media coverage, improving everyone's general mental health, and tailoring mental health support for different groups, for example LGBTQ+. Community, people with chronic health issues, and minority ethnic groups. Increasing research, data gathering, and monitoring. We can all help improve mental health for others by being interested in their well-being and listening to their problems. Providing support and taking an interest in others can reduce feelings of isolation on both sides.